Good morning. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety and working for Unified Command. Today is the briefing for Wednesday, July 22nd, 2020. We will start today with Dr. Angela Dunn from the Utah Department of Health, and she'll be followed by Governor Gary Herbert, who will also introduce one of our other speakers, Jake Fitisemanu, who is from the Utah Department of Health, as well as a West Valley City Councilman. So we'll start with Dr. Dunn.
All right, hello. Today we have 35,578 cases of COVID-19 identified in Utah. Our 7-day rolling average is 627 new cases per day. Last week, we were at 619 cases per day. We have tested over 480,000 Utahns for COVID-19, and our 7-day rolling percent positivity is 9.5%. This is a decrease from last week when we were at 10.4%, and our number of tested remains stable from day to day. We do have 10 new deaths to report today. All were hospitalized, residents of a long-term care facility, or had significant underlying medical conditions at the time of death. And more details were sent out about each one of those deaths in our email to the press. Our total deaths due to COVID-19 will only increase by 9 on our public dashboard today, and that's because one death was removed to undergo further investigation by our medical examiner to determine if COVID-19 actually caused the death in that individual. We've seen some really positive trends in our data over the past week. Even though our cases are still high, our hospitalization rate has been decreasing. We've seen only a 2% increase in our active hospitalizations in the past 14 days compared to the previous 2 weeks. And our overall hospitalization rate is now at 6%. We're also seeing evidence of a plateau followed by a decrease in the total statewide cases every day. And this started around July 10th. It's in part due to the large decreases we're seeing in the Salt Lake County cases every single day. That started around July 10th as well. So we need to continue to push to get our case counts lower, and we know how to do this. We wear face masks when we're in public, physical distance whenever we can, stay home when we're sick, and use good hand hygiene. If we do these things, we will continue to have the confidence we need to open up schools safely, engage in our economy, preserve our hospital capacity, and keep our communities safe. Turn the time over now to Governor Herbert.
Thank you, Dr. Dunn, and welcome everybody. Again, we're honored to have you here, and those who are watching at home, we wish you the very best. Particularly as we're heading into this holiday weekend, the 24th of July. I think there's a lot of things we can learn from our pioneer ancestors. They had their own unique challenges of the time and the day as they trekked 1,000 miles to what was then a very inhospitable land here in the Utah Territory. We celebrate their efforts and their work, but they had their own challenges. They battled, detractors that didn't like them, thought they were foolish too. They battled fatigue, the elements that they had to travel through and to, illness they had over their journey as they traveled that 1,000 miles, looking for opportunities to worship, to be free, to not be persecuted, and find a better life. I find some parallels today. We're all modern day pioneers, and we have our own unique challenges of today as we are kind of walking our pathway through this pandemic. Again, something we've never seen. It's an adventure, to say the least. We're battling some of the same things. We have detractors out there who don't believe the scientific information that's been presented. Some that don't trust the government to be doing the right thing. We're battling fatigue. We have fatigue over illness that's taking place of members of our society. We have fatigue over the concept of having to have social physical distancing, fatigue over the political haranguing that takes place on both sides of the aisle, unfortunately. We've also battled during this time an earthquake and nearly 2,000 aftershocks, part of our disaster recovery being compounded. We've had wildfires. We still have about 10 or so in the state right now. That's led to some evacuations, loss of property, the challenges that come. And of course, we're battling overall this COVID-19 pandemic and the economic free fall that that's caused in our state and throughout our country and throughout the world. So to say that 2020 is a challenging year is probably the understatement of the day. And it's probably something that we'll be talking about for years to come for many reasons. Our children, grandchildren are going to be asking about it. What was it like during the great pandemic of 2020? But instead, as we look to our pioneers again, instead of them giving up to despair and pointing fingers, and placing blame, the early pioneers really did come together. They knew it was better for them to work together, roll up their sleeves, take on the challenge of the day, and find the common good. They had unity, they had mutual respect for each other, and they took on what I would call a spirit of shared responsibility. That's what we need to emulate, take on the shared responsibility we all have to address this significant pandemic. And we can throw our hands up in despair. It's always frustrating. I get frustrated probably every day. It's easy to point fingers and blame a Monday morning quarterback and say it's somebody else's fault. Or we can, in fact, follow the example of our pioneer forefathers and let's come together and work together, roll up our sleeves and do what we need to do in shared sacrifice mode for the common good and for the betterment of the whole. That's what I think we should do, and that's what I think we are doing, in fact, generally speaking, as the people of Utah. So whether you're a first-generation Utahn or like me, a sixth-generation Utahn, it's our charge. In fact, I would say it's our responsibility and really an opportunity for us to be a good example to the rest of the country of how we can, in fact, address this challenge and other challenges that we face at this current time, just like our early pioneers met their challenges. Unfortunately, this Pioneer Weekend, which we look forward to every year, will be somewhat different than anything we've ever had in my lifetime. We know that cities and local governments have had to make some difficult decisions, limiting gatherings, parades, functions that we've had traditionally as a part of our 24th of July celebration. They've had to make those tough decisions with the goal in mind to help protect the health and welfare of the people that they represent. We applaud their efforts and appreciate the fact they're having to make some tough decisions. As we head into the 24th of July weekend, and many of us will be gathering with family and friends as we celebrate in many different venues around our state. But as we gather in these groups, which is somewhat of a tradition for us with our families and friends, I would ask you to please adhere to these common sense healthcare guidelines that have come about because of the COVID-19 pandemic. I would suggest to us all that we gather outside whenever that's possible, and certainly as much as possible. We find that as the coronavirus is much less likely to spread if we're in an outdoor setting. The air circulation is better and less likely to, in fact, have us catch the COVID virus from one another. The science is telling us that differently than what we thought in the very beginning, 4 months ago, we're finding that people do spread the coronavirus even though they don't have any symptoms. They don't feel sick. And so physical distancing is still very important, something we're not used to doing. But standing 6 feet away from each other helps us stop and slow the spread of the coronavirus. And something that, again, is not our habit, but something that we need to do, particularly as we find now that people that have no symptoms, don't feel sick, actually have the virus load and can spread that to others. If you can't keep your distance, if you go inside, for example, where physical distancing is not possible, then please wear a mask. It's okay, obviously, to take off your mask when you eat, drink, but you ought to have social distancing take place there, the 6 feet apart as you're able. And when you're done eating, you ought to put your mask back on. This weekend, when I'm going to be with my family, I can tell you I will be wearing my mask. I think that's showing respect for my family and members, my loved ones, and that makes them feel more comfortable too. And all of us should be doing it. I'll just make this plea again. When you can't physically distance from others, it's imperative that you wear a mask. I would encourage people to, in fact, read, and I know this is in the press here, the recent BYU study, which when it was compiled, the professors there, the data analysts, had looked at over 115 different scientific studies on COVID-19. Here's what they found. Cloth masks can stop 90% of more of the dispersal of droplets carrying the virus. 90%. Masks are highly safe to wear, with only some minor and uncommon side effects. Not perfect, but by golly, it's not as unsafe as we hear from many out there. In fact, it's virtually not a problem for any of us to wear the mask. Public masking has been proven safe among children, adults, and the elderly in cultures where this practice has long been utilized and has become common. Masks could be one of the most powerful and cost-effective tools to stop the COVID-19 and its spread and accelerate our economic recovery. They go hand in hand. So we know it is, in fact, right now, the most cost-effective way to slow down the spread of the coronavirus. Let me just add, though, that masking alone will not, in fact, stop the pandemic. Masking is the most effective when it's accompanied with social distancing, working in tandem together, making sure that we have that 6 foot of distance. Frequent hand washing. Again, we need to wash our hands, sing happy birthday twice or 20 seconds, and make sure that we have good hand hygiene, as you heard Dr. Dunn talk about. Testing, we need to do, and we're going to emphasize over the next couple of weeks, testing and the ability to have people tested and get those reports and testing results back in action. And certainly that'll allow us to do the last step, which is coordinated contact tracing, which again will help us isolate those who have the coronavirus and stop the spread. That's something that's critically important for us to move ahead with today. I believe the science is virtually unanimous. It's very clear that wearing a mask will help keep people who have the virus but aren't showing the symptoms from spreading it to others. So again, counsel to all of us, be wise and wear a mask and social distance and wash your hands. I'll also mention, not only we're hearing more and more from the scientific community, but as we have people in our community, our different groups that are starting to weigh in on this. We've had the medical community has been at the very forefront on this. They've been pretty well united in this effort. Our hospital association, again, we're concerned about making sure we control this pandemic so we do not overwhelm the hospitals and our medical systems, but they're at the forefront saying we should wear a mask. We also have our business community, our chambers of commerce weighing in, saying that we want to make sure that we're safe so that we can, in fact, stay open. They don't want us to have some kind of a surge that causes us to roll back the economy from a yellow condition to an orange condition to put on more restrictions. They would much prefer us all to together wear face covering. We've also seen the faith-based organizations in our state unite in their efforts to tell their followers, please wear a mask when at all possible. If you can't social distance, wear your mask. They're united in that effort. And I appreciate the fact now that we see the last couple of weeks that the administration in Washington, D.C., the president and the vice president both now advocating for the use of masks. They've been a little slower maybe to come along, but they're there now. And they're saying to all of us, we should follow their example and wear a mask when we cannot social distance. I think that's kind of what we've developed here as we've learned more about this coronavirus over these last 4 months. The science is now coming to the fore. We're learning more, understanding more. And again, part of being a good citizen, being a good neighbor, if you love your neighbor, let's see what we can do to protect them from catching the virus, and so wear the mask as a good citizen. I know it can sometimes be hard. It's not part of our culture in the past, like some other countries around the world. It's hard to be the one lone example of wearing a mask. That's sometimes difficult. But we do it because we love our family and friends, and we also recognize that that's going to help us get on top of this pandemic. I should emphasize too, everybody in the scientific community says that this is only going to be a temporary situation, but it will help us make it a shorter duration of time before we get to our full open of our economy throughout the country. It's certainly going to help us until we get a vaccine and a therapeutic medicine to help us with this pandemic. I think that's around the corner. I think should be very encouraged by some of the news reports that have come out here in the last few days of clinical trials, and where the medical community is thinking that we're on the verge of having some breakthroughs on a vaccine that will help inoculate us against the COVID-19 virus. I appreciate Dr. Miller last week from the University of Utah encouraging us to wear masks. And he used a good phrase that I think we all should use. And he said, until there's a proven vaccine or some other therapeutic medicine provided for us, the masks are our medicine for this pandemic. So let's wear the mask. With that, again, we're concerned about some of the rise of the pandemic and the surges of infections in some of our communities of color. They have a higher incident of that taking place. So we'll have the opportunity to hear from Jake Fitisemanu, who's a West Valley City Councilman. He's the chair of the Utah Pacific Islander Health Coalition and is a member of our Multicultural Subcommittee of the Utah Coronavirus Task Force. And he's going to talk to us about this disproportionate and unique effect that happens on certainly the Pacific Islander community, and give us some counsel what we can do and what they can do, particularly to help curb the spread of this virus. So, Councilman Fitisemanu, Jake.
Thank you, sir. I'm mindful that this is being translated into other languages in real time, so forgive me if I read or speak slower than I normally would. Amalo Ma'ailopa was a young man in 1918 when the influenza pandemic ravaged the Samoan Islands and killed 1 out of every 5 Samoans on the planet. He was among those who survived and were left to bury thousands of people in unmarked mass graves throughout the island. Today, 102 years later, his great-granddaughter, Luisa Auva-Atupo, is a community health worker on the front lines of the COVID-19 pandemic right here in Utah that is claiming lives and disrupting livelihoods in her community. Bilingual, trusted by community, and trained in evidence-based public health, Luisa and her colleagues are uniquely poised to address this pandemic in our community in ways that government agencies or healthcare systems may not be able to. Luisa embodies the ingenuity and the resilience of generations of survivors like her great-grandfather. And those are traits that she shares today with tens of thousands of Pacific Islanders that call Utah home. Talo falava, faftaimon ne avanoa. My name is Jake Fitisemanu, and I'm proud to be here today as the chair of the Utah Pacific Islander Health Coalition. For the last 2 months, Native Hawaiians and Pacific Islanders in the state of Utah have had the highest infection rate of COVID-19 and the highest hospitalization rate for COVID-19 in Salt Lake County, and the second highest infection rate and the second highest hospitalization rate in the state overall. The data that is shared here from this podium pretty much every day confirms that COVID-19 isn't impacting all groups with the same level of severity, and Native Hawaiians and Pacific Islanders are among the hardest hit in our state today. This pandemic has interrupted lifestyles, it's disrupted livelihoods, it's taken lives in our community. And every Pacific Islander family, congregation, and cultural group in the state has been impacted in one way or another. Many factors contribute to this disparity, including a high prevalence of underlying health conditions that make folks more susceptible to contracting and more at a higher risk of complications and hospitalization. We have housing and family dynamics that increase the likelihood of spread through large multi-generational households, increased likelihood of exposure due to essential employment in service industries and hospitality, manufacturing and warehouse sectors, and cultural practices and customs that that simply aren't aligned with the tenets of social distancing. Also, our Pacific Islander populations in Utah are geographically concentrated in some of the zip codes with the highest infection rates currently. For these reasons and others, our Pacific Islander community is at much greater risk of contracting COVID-19, at a greater risk of being hospitalized, and possibly succumbing to COVID-19. On behalf of over 47,000 Native Hawaiians and Pacific Islanders in the state of Utah today, we are asking our friends and neighbors to work with us throughout the state to help us stop the spread of COVID-19. We echo the calls of our cultural elders, of our family chiefs, of religious leaders and public health officers and civic officials in strongly emphasizing the need for physical distancing, for wearing face coverings in public, for good hygiene practices. The Utah Pacific Islander Health Coalition was formed 10 years ago as a resource hub for health promotion for Pacific Islander families and all of our neighbors. We have a dedicated team of trained community health workers and an extensive network of community partners with capacities to serve and help in Samoan, Tongan, Marshallese, and other Pacific Islander languages. This is not the first time our community has overcome adversity. This is not the first time our Pacific Islander people have survived a global pandemic. History shows that the island nations that enacted quarantine measures and implemented preventive public health measures were spared the terrible death toll that was experienced in Samoa in 1918. That's a very poignant lesson for us today. It's not easy, but if we work together, we can do more to protect our families, to preserve our cultures, and to prevent COVID-19 from taking more from us than it already has. We stand in solidarity with all agencies, organizations, and advocates who have the interest of Utah's people at heart. For information on prevention, testing, and other resources, please contact us at upihc.org. That's the acronym for Utah Pacific Islander Health Coalition. You can find us on Facebook and or call 385-202-3679. I'm sure that contact information will be shared with the press as well. Again, this issue is real. It's taken a while for some in our community and at large to come to that realization, but it's not too late. This is the time to be stronger in our resolve and to do all that we can to protect our families, our neighbors, and our communities. Thank you very much.
Thank you, Councilman Fitisemanu. I'm grateful for people like Jake. He works with our health department. He's a local government official trying to do his civic duty out there in many different venues. And people like him that have helped us come together as a state, working from the beginning to see what we can do to protect people's lives and protect their livelihoods. As I've observed across the country, some states have leaned into one side of the equation a little harder than the others. We've done, I think, in a very balanced approach to try to, in fact, get that equation to be a balanced effort. I'm grateful for the fact we have the lowest mortality rate in the nation at less than 1%. And we have an unemployment rate which is the second lowest in the nation. That being said, you know, we still have much room for improvement. And for those who lost loved ones, you know, we mourn with you, we love you, we're sorry for this unique situation, and we need to do better as a state, as a community, to find ways to solve this particular problem. It really is going to take a collaborative effort. We need to work together, and I think this, and as you heard Jake say, let's take this very seriously. I'm sure we do, but make sure that all of us take it seriously and act responsibly in our efforts to slow the pandemic. We've been working from the beginning with healthcare officials and economists and business community leaders to find that right balance. And I feel good about where we're at, but I certainly think we need to do even more and work harder together to get to the results we want. Let me just, as I finish up here, and then we'll take some questions, make a couple of different data points here. One, we had an earthquake. I mentioned that earlier. We all know about it, about 2,000 aftershocks, 5.7 on the Richter scale. Some folks had damage done to property. There's questions about how you can, in fact, get some compensation. Most insurance policies may not cover your earthquake damage, but we have a web page we put up called disasterassistance.gov, disasterassistance.gov. You can go there and register and see if, in fact, we have some federal funds and some opportunities for you to help pay for some of your loss. So please check that out and see if you're eligible for some help with some federal monies. Last but not least, kind of a final reminder as we go into this 24th of July holiday weekend. We know that starting today, fireworks become legal. Now, we have many places that have been closed down for fireworks. Some places are open. We'd encourage you to check with your local government leaders to find out where you can, in fact, either view legally if there's any kind of a celebration going on. Many have been canceled, but there's some still have some opportunities to see fireworks and have a firework display. So check with your local communities to see where you're at. We remind you to use them safely. Many of you will be going out on the weekend to maybe camp out. We again remind you that it's tinder-like conditions out there, so be extra cautious, extra careful. Mind where you park your automobiles. We have fires that are started because of a hot manifold and the undercarriage of your motor starting a fire on some dry tinder-like weeds. So be careful, use some good common sense. The State Fire Marshal has information on local firework ordinances in the communities around the state. You can go to his website at firemarshal.utah.gov, firemarshal.utah.gov. We should all be careful, keep water handy. If you have some sparklers or fireworks that you're using at your home, be careful, but have a safe and happy Pioneer Day. So with that, we're happy to take some questions. We'll have Jake here and Dr. Dunn. So we'll start with our questions.
Yes. Hi, Governor Herbert. This is Sophia Eppolito with the AP. I was wondering if you have any comment on the data that's been released on the decreased case counts since the mask mandate was implemented in Salt Lake County, and whether it makes you any more likely to think about issuing a statewide mandate.
Well, I think all of us, certainly I've been advocating for the use of face coverings and masks for a long, long time. And I think the science is now accumulating. Again, the BYU study, I think, gives us really a point of reference where they reviewed 115 different scientific studies on the utilization of face coverings and face masks, and does it, in fact, help slow the spread of the coronavirus? And the answer is absolutely yes, it does. And so I think we're all kind of coalescing around the science. I would hope that we are and follow the directions of our medical advisors. And we'll have to wait and see. I'm not ready to say that's the absolute cause and effect of the reduction in Salt Lake County. Certainly, I don't think has hurt the cause. We haven't seen quite the similar reduction in Summit County. So there's probably a lot of different factors afoot there. But I'm one who does advocate and believe the science is behind us to say wearing a mask is, in fact, the most effective, cost-effective, and most efficient, effective way to slow the spread of the coronavirus. We've given a kind of a goal for us to get below 500 cases a day on average. We've seen some movement in that direction the last week. I'm grateful for that. I see more people wearing masks now than ever before as I get around the state. I think it's becoming something that's more normal, and people appreciate the positive impact that wearing a mask can have on the slowing the spread. So I think people are getting used to that and are doing more of it on a voluntary basis. But as I've mentioned before, one tool in the toolbox is in fact a statewide mandate. And that still remains in the bag of tools. We'll see how we're doing by August 1st. But I would hope people would just do it, as I've said many times before, just do it without having to be compelled to do it, because it's the right thing to do. Protects your own health and those around you. There's no reason not to wear a mask at appropriate times when you can't social distance. Next question.
Yes, Governor, this is Ross Trell with KUER. You mentioned that goal of getting below 500 cases by August 1st, but we're still in the 600 range. What does happen if within the next week or so we don't see that number decrease? What are some of the social restrictions we could see put back into place?
Well, I don't want to presuppose what I'm going to do. I'll let the data inform us. I felt good about a couple of days we've had here in the 400s, in the low 400s. And so I hope that ends up becoming the trend, that we're reducing the caseload. I think as more people get informed and understand the science behind it, they'll be more willing and more desirous of wearing face coverings. So I hope that happens. But there's probably a lot of different options. We could mandate just the businesses to have a requirement that when you come and frequent their establishment that you have to wear a mask. The chambers of commerce and business community like that, and we're seeing a significant movement by the private sector to say we want to have a safe environment for our customers, for our employees to come and work, and when customers come in, we want you to help make it a safe environment by requiring you to wear face coverings when you come in to our establishment to shop, whether that be a restaurant, retail outlets, those kinds of things. There's clearly a shift moving in that direction in the private sector. And I applaud those in the private sector that are taking that step, because I think that's an appropriate one to take. So we'll be counseling with our medical advisors, our scientific people, looking at the data. Certainly we have input from the business community too, and a balanced approach. So we'll wait and see what the data informs us by August 1st and then decide what to do next.
Got it. And one more question for you. We know a number of school districts are starting to release their reopening plans. Are there is there any concern from you, or what advice would you give to teachers who may feel like there aren't going to be an adequate amount of PPE supplies and they have to spend their own money on that? I know for businesses, there's a grant that they can apply for from the state. Will there be an option like that for teachers as schools start to reopen?
Well, we're working very closely with the state school board, who's working in turn very closely with the local school boards. That's 41 districts throughout the state and their superintendents. And certainly working with the teachers to make sure that we provide a safe environment for education to go forward. We're concerned about anybody who goes to an education building, that it's a safe environment there, not only for our students, which is a primary concern, but also for teachers, principals, faculty, all those from the janitor to the bus driver. They should expect to go to a safe environment. Now, there's no way to eliminate all risk. What we're trying to do is manage the risk and make sure that it's as safe an environment as we can create. There are concerns by many people on different reasons, but we're working very closely. I'm expecting that all the districts will have their own plans in place by August 1st, and they'll have plans in place of how they're going to open and what kind of format will they open in. Some are going to start maybe with some online before they actually have people coming into the classroom for face-to-face instruction. We respect regional differences that are there in the state. They're not all the same, and one size fits all won't work. But we're moving in the right direction, and people are actually pulling together very nicely, I believe, on the public education front.
Good morning, Governor. Good afternoon. It's Sean Means from Salt Lake Tribune. A couple of financial or money-related questions. First off, do you believe the state needs to provide extra funding to schools to help them reopen, either with more equipment or more training or whatever? And then secondly, what do you want to see in the next federal stimulus bill that's being negotiated right now?
Well, I think there's the opportunity. The state has stepped up, the legislature, and providing some money for some grants to help with business issues. We, in fact, the biggest part of our budget is, in fact, really in public education. We do have some monies, rainy day funds, which are one time only can be utilized. It's not an ongoing revenue stream. But I think as we analyze the requests that come to us from the school districts, they have a bucket of money themselves. If there's additional monies that are needful, they will be making a request to that. We will have a special session probably sometime in August. I think probably around the middle part. And so there may be a need to adjust some budget requests at that time. That will be the opportunity. And we'll ask the education folks to work with our legislative leadership. They control the purse strings, and see if there's money that they need to have that's available for them to utilize. So that process is in place right now. The last question on the federal stimulus package, it's really designed to help with recovery. I think that's a better term than stimulate. I think our economy just needs to get back to normal. The fundamentals are certainly here in Utah still in place. The employees that have been on unemployment lately really have been furloughed. That means they are attached to a job they can go back to. Again, at 5.1% unemployment rate, we're doing much better than most of the country, probably 5 or 6 percentage points below the national average. So we're poised to start back into recovery mode, and I think that's going to happen. I am a little concerned about the federal government, which seems to be very easy for them to write a check, but then they have to go borrow the money. And I'm a fiscal conservative in Utah. We've been very careful about how we spend the monies. We don't have irrational debt, and we don't have what we call structural imbalances, which means we don't pay for ongoing needs with one-time money, because then you have to borrow more and more and more, which we see the federal government doing. I see last month we had nearly $1 trillion deficit in 1 month. That's not sustainable. So we need to be a little careful on how we pull back or pull on the throttle. And I hope that people are really being careful that monies are being put where they really absolutely need to be put, because it's going to come back and bite us sometime in the future where we have this large deficit that we're creating this year. Now, again, I'm not opposed to what's being done with the CARE Act. I think some of the issues that have been put in there have been really beyond what was needful for the stem of the pandemic. Some Christmas tree ornaments have been put in that package that probably were not necessary, but that's politics in Washington. You have to kind of get both sides of the equation to come together, and something for me and something for you, and then we get something we have a compromise on. So we'll have to wait and see. I see both sides of the aisle are talking about another $1 trillion stimulus package. Let's just make sure it goes to those who really need it. And we need to be very careful on how that's being spent. I have no special requests.
Thank you.
Good afternoon, Governor. Brian Leahy here. A couple of questions. Should your office more widely disseminate the reports from the White House, including the one that came last week on the red zone states? And I talked to a member of the coronavirus task force who said that was not disseminated by the task force. And for people who might say the task force may seem like a toothless tiger, how would you respond?
Well, the report that came out of the White House, again, I don't know why it's not being distributed. I have no qualms about whatever they say being out in the public. They've said a lot of different things and really have in many ways been an uncertain signal to us as things have shifted. That's not all their fault. Again, the science is evolving. We're learning as we go. This has been a unique situation. There's a lot of uncertainty of how we deal with it. That being said, what I do trust is our own people. The data that they have that there is in the report has come from us. I believe nobody can interpret that data better than Utahns and the people we have in our own system here, our healthcare experts, our data analysts, our scientific people, our economic development working together in concert understands that better than most. And the results we have been pretty good. I'm not happy that we're, where we're at now with the rising rates of coronavirus, but when it comes to balancing economic development, which is by polling now is the number one concern of the people of Utah, is are they going to have a job? They're more afraid of that than they are catching the virus. It's about a 60-40 split. But we're concerned about both aspects of that equation, and we don't think they're mutually exclusive ideas. So we've tried to find that balance point that makes the best sense to protect people's health and protect the economy. So we're going to continue to use our data and analyze it ourselves. We think we're better at doing that, and we have a really great team that's been assembled. That includes the COVID-19 team. And again, they're going to be redouble their efforts now on testing to make sure we see what we can do to improve testing, and particularly the turnaround times. We've become overwhelmed in that area. We're testing a lot more people, but our ability to get the test through the labs now, that's become somewhat of a bottleneck and has slowed down the results. That's not acceptable. So we'll be making a significant efforts there. The idea that somehow it's a toothless tiger is a mistake. That's not true. We get advice from a lot of different sources. We certainly are inundated with people that say we've got some suggestions for you to take. And I get that when I'm at the grocery store in the produce department. People, hey, I've got an idea for you. And so that's just kind of the way the system works right now, particularly where there's so much uncertainty and we're kind of learning as we go. But I feel very good about those who are advising me. I feel good about where the legislature's at as we try to work together with the United Front. I think we're doing things fairly well, but we still have a lot of room for improvement.
Hi there, Governor. Mike Hedrick with KTV. You mentioned earlier that there's, the core of contact tracing is critically important in this effort. So other than assessing symptoms, what's the current benefit of the $6 million Healthy Together app, and what's being done to further contact tracing right now?
Again, we're trying to improve that effort. Again, there's a lot of confusion, I think, on the app. We have people who don't like it because they think it's Big Brother watching them. We've worked with the people involved with the app, 20, and trying to make sure that it works. We've certainly talked with Taimur Semnani and his approach. He thinks he has something that can be worked together. That's in the process of being discussed to see if there's a way to merge those two technologies together. But let me ask Dr. Dunn if she'll talk about contact tracing, what we're doing there.
So contact tracing is a cornerstone to our public health approach to controlling the pandemic, and it has been since the very beginning of this. We're constantly increasing our capacity to do contact tracing in Utah at the State Department of Health. Nearly 200 contact tracers, and there's also funds going out to the local health departments so that they can build local capacity to have nearly 200 contact tracers in the local health departments as well. So we're constantly working towards being able to contact every single new case within 24 hours. And for the most part, we are able to do that, and it is working well. And we can see that as evidenced by our decreasing case counts in the past few days.
A couple more questions.
Hi, Governor. This is Jacob Kloffenstein with KSL. Wanted to ask a couple of questions about an article that ProPublica published yesterday, just kind of about the response here in Utah to the coronavirus, and especially with the Public Health and Economic Emergency Commission. One of the things the story suggests is that there was kind of a shift to looking at hospital capacity as kind of one of the main, factors into our response here in the state. So I wanted to ask if that's a fair representation of what actually happened here, and if so, why? And then the story also makes mention that Dr. Miner from the Department of Health maybe might have not been involved in some of the key decisions and meetings that were made. So I'm wondering if that was the case, and if so, why he hasn't been involved, and why more health officials haven't been involved with the Public Health Economic Commission.
Well, let me see if I can remember all those, Jake. One, it would be a mischaracterization to think that somehow we don't care about the health of our citizens. That's the primary focus. But we've also said from the very beginning, this is not health care for individuals versus the economy or vice versa. It has to be a balancing act. We have people who are very concerned and actually have health care problems if the economy is not opened up. So we've taken, I think, a very wise and prudent approach to say we need to do both. And we've, again, as I've mentioned earlier, we're learning as we go. The very first objective we set in the very beginning, 4 months ago, let's make sure as we go through this process of addressing this pandemic that we do not overwhelm the healthcare system. That means hospital capacity, bed space, etc. We, in fact, went with the local hospitals and we eliminated some elective surgery to make sure we had capacity. Now, we've learned as we've gone through this that we, in fact, have maybe more capacity than we thought originally. The hospital beds right now, we're utilizing less than half of about 4,200 or 4,300 overall hospital beds in the state. We're utilizing currently, with all factors out there, less than half of them. We're utilizing about 18% of the ICU beds for COVID patients. And so we have other COVID patients that are using other hospital beds, by the way. But still, we have significant capacity right now in our hospital. If we stay at the same level, we're probably going to be okay. Our goal is to get down below 500. So if we have a surge, we have headroom and capacity. So some of that is changed. It says we've evolved and we've learned more about the ability we have to address the COVID-19 virus. It's not one versus the other. It's both of them working together in concert. So again, has there been a shift? I don't know if there's been a shift. It may be just the natural evolution of what's happened in the marketplace as we've had more and more people get tested, and we've had this community spread of the virus using more capacity in our hospitals. What have I forgot to answer, Jake?
So I wanted to ask about Dr. Miner and his involvement
Okay, sure.
With the Public Health Commission. ProPublica reported that he hadn't been involved with some of the decisions that were made, so I'm wondering why he's not getting involved
Well,
consistently.
that's not true. That's not a fair characterization of Dr. Miner's responsibility as the department head of the State Department of Health. I've known Dr. Miner for many, many years. I worked with him when I was a county commissioner in Utah County. He's a very bright, brilliant man and a medical doctor in his own right. You don't always have a medical doctor at the head of your Department of Health, but he's been very much involved in public service throughout his entire career. He has his own health issues, and so it's very difficult under this pandemic for him to come into the office every day and participate because of the uniqueness of his own health. So we've been a little bit deferential to him. We brought in General Burton, who's trained in kind of command and control issues. We need to have that to happen, to direct the Department of Health where to go and how to do it. And he's brought some significant expertise in that area. I think in virtually every instance, whether Dr. Miner's been at the table in the original consultation or has been by telephone after the fact to getting his input, he's been a key player every step of the way. So it would not be an accurate characterization to act like he has not been involved. There may be one or two issues that have been he's not been here around the table on, but that would be the exception rather than the rule. He continues to be a very valuable asset to our team.
Thank you.
Hi, I was actually hoping to ask a question of Dr. Dunn, if that's all right.
You bet, Dr. Dunn.
Thank you, Governor. Dr. Dunn, hi. You mentioned a plateau in case numbers and possible decline that started around July 10th in Salt Lake County, I think. Is that causally related, do you think, to the Salt Lake County's mask mandate? And then just a quick related one is the governor indicated that the situation might possibly be different in Summit County. And I was wondering if you could address that.
Sure. For Salt Lake, we did start to see a decline about 2 weeks after the mask mandate, but so it's correlated. There's tons of factors that go into why cases decrease. So to pinpoint it as exact cause isn't possible, but it's likely correlated due to the timing. As far as Summit County, so they actually have a really low case count. So there is volatility in their number of cases from day to day because they are seeing low case counts. So it's tough to really identify stable trends when there are low case counts. So our most reliable, of course, number and a way to do trends in a county is with Salt Lake just because of the population and the case counts there. Okay.
Thanks.
All right, well, this will be the last question.
Hi, this is Taylor Hendricks with ABC4 News. Question again for Dr. Dunn. So, Dr. Dunn, earlier last month, oh, sorry, I'll let you get to the...
You're fine.
Get to the podium. Okay. So earlier last month, you announced that indoor cultural events can have up to 3,000 people and 6,000 at an outdoor event. But from what I've seen, a lot of events are being canceled. And is it necessary to cancel these events coming up, for later in August, September, or should these cultural events simply, just take precautions?
I'm not involved in any decisions to actually cancel events. And of course, those who run those events have the ability to do what they think is necessary. So I'm not aware of any specific situation and can't really comment on that with any more clarity. I apologize.
That's okay. Thank you.
Let me just add my view. I go to a lot of events, and I know that a lot of events have been canceled. Some of it's because of the uncertainty. And to go to the time and expense to organize some of these major events and maybe have it canceled last minute makes it a little bit difficult. I know we've had canceled the Freedom Festival down in Provo and the parade there, which is our largest parade in the state. And part of that's because you can't get the social distancing needs at a parade. Even though we have opportunities to have larger events, there still is a need to have oversight and protocols in place. And so that's the challenge, and sometimes that becomes a little more difficult than the effort's worth. So we're hopeful that, again, as we all work together, that we can in fact have events, larger events that take place maybe later in the year. And certainly we want to have 2021 to be back to normal as best as we can. And I think that's really within our grasp. I think that really is not just wishful thinking, but I think that is in fact possible. But as I've said from the very beginning, we have good plans in place. We've got good data, good science, but we do have individual responsibility. And so again, as we look at this Pioneer Day weekend and the opportunity to celebrate our heritage, let's follow their example of how they rolled up their sleeves and worked together. They didn't blame anybody for their cause and for their situation being out here. They said, let's carve out a success here working together. It may require compromise. It may require us to work together with people that maybe we sometimes disagree with. But that's our charge today. So I hope that as we celebrate Pioneer Day, follow their example and make something better as we work together. I believe we can do it. That's the Utah way. I think better times are ahead of us. I think we're in the area of getting into stabilization. Hopefully by the latter part of this year, we can be in full-blown recovery and have 2021 be a great year that it has the potential to be if we work together. Thank you very much.
We'd like to thank all of our speakers who addressed us today. Also, a special thank you to our friends in the media who helped tell these really important stories. Just a quick note on how we do this. Every week we randomize the questions or randomize the people who will be asking questions during these press conferences. So that's why we see a different mix of reporters every single time, and we appreciate all of you and your patience, and we're sorry we do have limited time for these press conferences. So we're grateful for all of you, and this will conclude the briefing for today, and we